I'm going to present two videos. They'll be relatively short. One is about heart attack. You've seen it before. Some people have seen it before. Other will be about strokes. But I want to tie it in with what Dr. Della and Jessica will be talking about later, which is nutrition and exercise. And that we're looking at doing those things to try to prevent you from having these really, really bad outcomes, such as heart attack, strokes, and so on and so forth. So that's going to be the reason for me showing a couple of videos, relatively short videos, but I want that to tie into what they're doing. I guess I'll do stroke first. We're locked in stroke, so let's do stroke first. So let's go.
I'm Dr. Robert Brown, neurologist at Mayo Clinic. In this video, we'll cover the basics of a stroke. What is it? Who it happens to? The symptoms, diagnosis, and treatment. Whether you're looking for answers for yourself or someone you love, we are here to give you the best information available. You've likely heard the term stroke before. They affect about 800,000 people in the United States each year. Strokes happen in two ways. In the first, a blocked artery can cut off blood to an area of the brain, and this is known as an ischemic stroke. 85% of strokes are of this type. The second type of stroke happens when a blood vessel can leak or burst, so the blood spills into the brain tissue or surrounding the brain, and this is called a hemorrhagic stroke. Prompt treatment can reduce brain damage and the likelihood of death or disability. So if you or someone you know is experiencing a stroke, you should call 911 and seek emergency medical care right away. Anyone can have a stroke, but some things put you at higher risk and some things can lower your risk. If you're 55 and older, if you're African American, if you're a man, or if you have a family history of strokes or heart attacks, your chances of having a stroke are higher. Being overweight, physically inactive, drinking alcohol heavily, recreational drug use, those who smoke, have high blood pressure or high cholesterol, have poorly controlled diabetes, suffer from obstructive sleep apnea, or have certain forms of heart disease are at greater risk as well. Look for these signs and symptoms if you think you or someone you know is having a stroke. Sudden trouble speaking and understanding what others are saying. Paralysis or numbness of the face, arm, or leg on one side of the body. Problems seeing in one or both eyes. Trouble walking, and a loss of balance. Now, many strokes are not associated with headache, but a sudden and severe headache can sometimes occur with some types of stroke. If you notice any of these, even if they come and go or disappear completely, seek emergency medical attention or call 911. Don't wait to see if symptoms stop, for every minute counts. Once you get to the hospital, your emergency team will review your symptoms and complete a physical exam. They will use several tests to help them figure out what type of stroke you're having and determine the best treatment for the stroke. This could include a CT scan or MRI scan, which are pictures of the brain and arteries, a carotid ultrasound, which is a sound wave test of the carotid arteries, which provide blood flow to the front parts of the brain, and blood tests. Once your doctors can determine if you're having an ischemic or hemorrhagic stroke, they'll be able to figure out the best treatment. If you're suffering an ischemic stroke, it's important to restore blood flow to your brain as quickly as possible, providing the oxygen and other nutrients your brain cells need to survive. To do this, doctors may use an intravenous clot buster medicine, dissolving the clot that is obstructing the blood flow. Or they may perform an emergency endovascular procedure. Now, this involves advancing a tiny plastic tube called a catheter up into the brain arteries, allowing the blockage in the artery to be removed directly. Unlike ischemic strokes, the goal for treating a hemorrhagic stroke is to control the bleeding and reduce pressure in the brain. Doctors may use emergency medicines to lower the blood pressure, prevent blood vessel spasms, encourage clotting, and prevent seizures. Or, if the bleeding is severe, surgery may be performed to remove the blood that is in the brain.
So I'm going to pause there with that, and let's move on to the next one. Here we go. Very good.
Sir, are you okay? Are you okay? Can I help you at all?
I'm okay. I'm okay.
You're clutching your chest. Is another part of your body hurting? Anything else hurting?
I'm having trouble breathing,
Okay.
and my arm's a bit sore.
All right, you know what? I'm going to call for some help, but let me get you into a more comfortable position. Come on over here. Let's get you down on the ground. I think you'd be more comfortable this way. Great. All right. And I'm going to call 911. You stay right here. Help's on the way. They should be here really soon. I'm going to stay here with you. There we go.
Mark is experiencing a heart attack. Calling 911, encouraging him to get into a semi-seated position, and reassuring him are the right things to do. If Mark was a family member or friend, offering one adult dose of uncoated aspirin would also be recommended if he was safe to take aspirin. Now let's go inside the body to see what is actually happening. The heart is responsible for pumping blood throughout the body via blood vessels, also known as the circulatory or cardiovascular system. The blood carries life-giving oxygen and nutrients that are needed by every cell and tissue in the body. Keeping our arteries healthy, clean, flexible, and free of plaque is key to ensuring cardiovascular health. The heart is a muscle, and just like every other organ and tissue in the body, requires blood and oxygen to stay alive. The heart receives its own supply of blood from a network of arteries called the coronary arteries. A heart attack occurs when there is a blockage in one of the coronary arteries. Without blood and oxygen to that part of the heart, the tissue begins to die. If left untreated, permanent tissue damage or death will occur. A blockage can occur for a few reasons.
Again, guys, time is muscle. For brain, for strokes, time is brain. Heart attacks, time is muscle.
Young, healthy arteries are flexible and elastic, but over time the walls of our arteries can harden and become blocked. Atherosclerosis is the buildup of fatty tissues called plaque, which can narrow our arteries and restrict blood flow. A heart attack occurs if there is a blockage in one of the coronary arteries. Blockages can also occur for other reasons. Sometimes the plaque can break away from the wall of the artery and disrupt blood flow. Plaque can also break off, causing a blood clot to float freely. If the clot blocks blood flow through a coronary artery, it causes a heart attack. If a clot reaches the brain, it can cause a stroke. As a first aider, your job is not to diagnose. You will not be able to determine if in fact it is a heart attack, as naturally we cannot see inside the body. But your job is to recognize the signs and symptoms of a heart attack and act fast. Getting someone to the right hospital for the right care can make the difference between life and death.
I'll go ahead and turn things over now to Dr. Beatrice Cadella. She will be discussing with you all proper nutrition. And she is really a dynamo. She's been on, I think, every webinar that we've had. And so is Dr. Gavin, actually. And these people she's indispensable. So Dr. Cadella, I turn over to you for the nutritional side. Again, to let people know why we're doing this exercise part and this diet part. So I'll be quiet. I'll go out and I'll get back into the crowd with the webinar, with the event. Thank you.
Awesome. Thank you so much,
Okay.
Dr. Reynolds.
Dr. Cadellas, Dr. Cadella, can I give a brief commercial?
Yeah,
Again,
sure.
thank-
Well, I share
thank-
my screen.
thanks to each of you for joining. The Center for Health Promotions has partnered with the Florida East Coast Baptist Association, and we are working with the state of Florida. I share this with you all so that you can help CHP help us. These webinars require a minimum of 50 persons. So I'm asking those of you, we have almost 100 persons registered, but people forget. And so if you would help me send a quick reminder, it is critical, not only for the state, but this information is so valuable. I have a cousin, my mom is on, Pastor Jimmy Witherspoon. Jimmy is 41, 42, just spent 10 days in the hospital. He had a stroke. And so oftentimes when we're having our meetings, Dr. Gavin is somewhat surprised that we have to push and promote people to get this knowledge. And I agree with that. So please, my brother, please, my sister, share with someone and encourage them to come on. Thank you. Thank you, Dr. Cadilla.
All right, so today we will be talking about nutrition and physical movement. So I know Dr. Reynolds kind of used the first few minutes to discuss the seriousness of stroke and heart attack. And so this is something that builds up with time, right? This is a final event kind of where it's a cumulative effect of physical inactivity, as the presentation, as the video that Dr. Reynolds was sharing says. So we try to prevent these big events from happening by making sure that we're eating healthy every day and keeping that physical activity happening every day. So we're gonna talk a little bit about what does it really look like so that we can try to prevent those heart attacks and strokes happening in the future. So I do want to take a minute to talk about wellness. I have included this slide in other presentations too that we've had, other webinars, because I think it is very, very important to have wellness in mind when we start thinking about living a healthy lifestyle, etc. So if you go online and you type like the wellness definition, you will find tons of definitions from numerous sources. And this definition from the National Wellness Institute, it describes wellness as an active process through which people become aware of and they make choices towards a more successful existence. And this definition can be a little bit more controversial. I mentioned this before in another webinar. The reason why is because you could be aware of your choices that help you live a healthier life, but that doesn't mean that you can make those healthier choices. So there are environmental factors that we have to take into account that can restrict your choices. And then we're gonna kind of talk about the workarounds it, because you can experience food insecurity and financial insecurity, or live in a food desert that kind of enable you more to make unhealthier choices more than healthier choices. So it is a journey, and it is a cumulative effect of this daily decisions that we make to stay active and eat healthy so that we can prevent those major events that Dr. Reynolds was talking about earlier today. So as I mentioned, wellness is not about just weight loss or losing weight. It's not as easy as just, dramatically changing your diet from one day to another. Instead, I like to talk about wellness as a journey that has multiple dimensions, and we have to be self-aware of each of them so that we can invest time and effort on each of them, and they can complement each other and set you up for small successes. I've talked about in the previous webinars about like an upward spiral towards healthy living. And what that means is that you make a healthier choice that makes you feel really good, and that kind of sets you up for success or wanting to make another healthier choice. And that cumulative effect kind of puts you in an upward spiral where you feel better about yourself and you just want to keep going and going and going and doing more for you. So I took an image, took this image from a publication that's called A Wellness Approach, and it theorizes there are about 8 dimensions of wellness, and you can see them here. So emotional means how do you feel about yourself and others. Financial is financial, of course, monetary. Social, spiritual, and then occupational. So occupation is how satisfied you are with your work. There's also physical wellness, which we're going to talk about today. That's how you feel about your body, your activity, your diet, and sleep. And then there's intellectual wellness and environmental. So why do I talk about wellness? Because physical and nutrition are part of your wellness, but that's not just everything. And when we're thinking about going through this wellness journey, we have to also think about other things that are not physical or nutrition kind of aspects of your daily decisions or daily lifestyle. And if you're lacking in some of these dimensions, they can sometimes set you up for not so successful situations. And what we're trying to set up ourselves here is for an upward spiral, right? Where we want to make even more and more decisions that are healthier and make us feel good, so that we can continue on the upward spiral. So there is an overwhelming amount of information out there about different diets, herbal supplements, shakes, and programs that are targeted again for like a solution to either weight loss or maintain weight or eating healthy. But many of them are not that entirely effective, and they may not be the best option for you, depending on the different conditions that you have. Also, some of them can be pretty drastic, like keto diet, etc. And they might not be sustainable for you, especially if it's like a high protein diet. It means that you're gonna have to be consuming a lot of meat, etc., which could be expensive. And life happens. If you lose employment, you're in the process of transitioning employment, you're going through economic hardship, that might not be a diet that you can sustain. So they can only maybe work for like a limited period of time, but then you either gain the weight back or you plateau, or this diet might cause you to have high cholesterol. Then you go to the doctor's office and they're telling you that your cholesterol is high. So there's a lot of caveats to these diets out there, and now social media has become like even more aggressive towards it. Like, you can't eat this, you can't eat that. I've seen it myself when I'm in social media, and it's like, oh my God, one video tells me that milk is good, another video tells me that milk is not good. So it definitely can become pretty overwhelming. So there are people out there that can help you navigate what diet, what lifestyle, what physical activity can help make you make decisions that are healthier for you based on your conditions, based on your what your goals are, etc. And so there's examples of those can be a trainer. They can also be a wellness coach. You can also have a nutritionist that works with your doctor and kind of tailors that diet towards you. So definitely thinking about involving the right people into your team to help you on that wellness journey is something that is crucial and important. And then just want everyone to kind of remember that this is a journey, it's a way of living. And so there will be and should be repeated encounters with those specialists, trials and errors. And as soon as you have major life changes like relocation or changes in employment or in the daily routine, you should reevaluate that lifestyle that you kind of came up with, that team, and reevaluate, see if that is still feasible for you, or if you have to make necessary adjustments to continue to live that healthy lifestyle, given those different factors that are kind of impacting now your routine. So now let's talk about nutrition. So let's shift focus on now talking about some of the definitions that are important in nutrition. Specifically, let's talk about macronutrients and micronutrients. So both of these are very important in any part of diet. So macronutrients are divided into three. You see it here: protein, that's meat and fish. Then we have carbohydrates, which is sugar, and good sugar and fruits. It could be starchy vegetables like potatoes and grains, like rice and bread. Then we have fats, and these fats are oils that come from multiple sources like meat or fish, and other food preparations. And then we have micronutrients, and this is divided into three main components. So that's vitamins or macrominerals and also trace elements. So it's important to make sure you consume the recommended daily amounts of these, as any deficiency here can cause health problems. And if you go to the internet, you're going to find a lot of diets that are not backed by science. They can also be deficient in some of these nutrients. So as I mentioned before, it's important to navigate these diets and nutritional decisions with a doctor, with a nutritionist, a wellness or a wellness coach, or a physical trainer, to ensure that you're being appropriately supplemented, taking into account your specific needs and your conditions. So in terms of calories, and if you're managing your weight, so a lot of people are talking about weight loss, but there's people that they want to maintain their weight, they're in a healthy weight, and so they shouldn't be eating the same diet as someone that wants to lose weight. So if you're someone that wants to lose weight, you should be on a calorie deficit. If you want to maintain weight, you should be on a calorie that's balanced. And if you want to gain weight, then you're on a calorie surplus. But this is not all. And if you see that people are getting into a lot their diet, their bodybuilding, or they have specific goals in terms of their physical appearance, you have people that might want to gain some muscle mass. And so here it's not just calorie, we're also having to think about protein, because protein is very essential in building muscle. So all of those different modifications are done with a specialist, either your physical trainer, giving you specific exercises to build that muscle. The physical trainer can also guide you with a specific diet that you should meet every day, or follow every day, so that you can gain that muscle mass, etc. So when we're determining health goals, we have to calculate the caloric need, and that is going to be very helpful in determining if you're going to lose weight or gain weight or maintain weight. But as I mentioned before, that's not the full story. So calorie counting can be used for any of those, right? Weight loss, maintenance, and weight gain. But be very aware that focusing only on calories and counting calories is not sustainable long term. It can become very cumbersome. So it's only one part of having a healthy lifestyle. We also have to take into account that we have physical activity and nutrition. And so we can't forget the combination and the symbiosis that they have together. So there's a website that allows you to calculate your caloric needs by entering in your height, your current weight, gender, age, activity level, and then what your goal is in terms of your weight, if you want to maintain, lose, or gain. So that site is right here. I have the link. It's from NASM, and it's the National Association of Sports Medicine. And you plug in all your information, and it basically tells you, okay, in your daily intake, you should limit your calorie to, if you see it here, is 1,287. For someone that's Jane Doe, female, 150 pounds, measures 5'3", and it's 29 years of age. So here it tells you should be having about 40 carbs, 10 of fat, these are the macros, and then 50% of protein. And so depending on the type of diet that you want or you select, the caloric need need to be like categorized among the macronutrients. So another approach to healthy eating is the My Plate method. And sometimes these can all be combined too. So this approach breaks down your plate into 4 sections. And we have, I don't have dairy here on the top, but it should be separate. And so you see here, it has vegetables as the largest section. This is in the bottom left. And then you also have grain and protein and fruit, and then the dairy on the top. So you divide your plate into those 4 sections. And so 1/4 should be your grain portion, 1/4 should be your protein portion, and then the other 4th should be vegetables and fruit, or vegetables for your half plate, which is another plate method that I've seen that is evidence-based. And it's very commonly used. So instead of having a plate with fruit, you just fill up half of your plate with vegetables. And then these are the portions that are usually recommended for a normal calorie diet that is not for weight gain or weight loss. It's just to maintain weight. So we see here that the portions, every time you consume a meal, it should be 1/4 grain, 1/4 protein, 1/4 vegetable, 1/4 fruit, or half vegetables, and then you have grain and the proteins. You should limit the amount of grains to at least half a cup of cooked rice or cooked pasta or cooked cereal. And then that could be either a slice of bread, or if you have ready to eat cereal, 1 cup of ready to eat cereal. And there's more examples. You can actually look up My Plate method online. There's an app for it, and it gives you even more information than what I'm presenting here. And then you can see in protein the portions too, again, online. If you look it up, it's going to give you all the recommendations for portions depending on the meat and that type of protein that you want to consume. And then there's also 2 more diets that I'm going to go over pretty briefly. We have the DASH diet, and this one is evidence-based. DASH diet, it's to prevent different type of chronic diseases, and it's been proven to reduce the risk of having diabetes, high cholesterol, dementia, memory loss, depression, and high blood pressure. This one, DASH diet and Mediterranean diet are both backed by evidence, and it's in science, and it's recommended to follow. But some of you, like me, might not have a Mediterranean type of culture. And so thinking about how I can adapt my culture into my diet is something that we're going to talk about in the later slides, okay? But as a general rule, we want to keep, in order to follow a DASH diet, we want to keep our servings for grains here. You see 6 to 8 servings a day. For vegetables, about 4 to 5 servings per day, and so forth. Again, if you look up this diet online, you can find from reputable sources. I would make sure that every time you're going online to look up this information, that you make sure you go to a reputable source and not just any person or any website out there. So reputable sources, I would say, they're from like the government or organizations out there that are promoting general like health, or like major cardiology organizations or endocrinology associations. So the American Heart Association or the American Diabetes Association, it's composed of very well-known physicians, cardiologists, endocrinologists. They evaluate the evidence out there and make recommendations that are backed by science, and it's just not something that's just biased. Okay, so we're gonna kind of go over how to look these up online, and they have plenty of recipes out there that follow this diet too. So the Mediterranean diet also basically recommends that you consume 7 to 10 servings of fruits a day. And then have, if you're gonna have grains, try to have whole grains. Olive oil, it should be used for regular consumption. And then having fish at least twice a week or more. Red meat should be in small portions and it should be infrequent. Okay. And again, the Mediterranean diet is recommended by big national organizations that are well known to promote health. So the NIH, the AHA, the CDC, among others. I believe the ADA guidelines also recommend it too. And they have proven to reduce the risk of diabetes, high cholesterol, dementia, memory loss, depression, high blood pressure. And there's a lot of recipes out there that follow this diet. So let's talk about the good thing. How do I incorporate these healthy diets and recommendations that are backed by evidence into my culture? So there are a lot of websites where you can access recipes that are culturally diverse. So one of them is myplate.gov. Eatingwell.com is also another good one to visit. And there's also a diabetes-friendly diet that you can follow that I didn't present here, but the ADA guidelines have more information on that with the diabetesfoodhub.org. And then in addition to this, you can also go into local or multi-state prepackaged companies where you can pick the option to have a Mediterranean diet menu and pick from healthy recipes or prepared meals that follow that. And some of them can be affordable, some of them cannot. I sometimes find myself like thinking that this is pretty expensive, and sometimes I can, get the luxury of purchasing these. So we'll talk a little bit about this. So before we go ahead and navigate online, I did want to present additional resources out there. If you have a smartphone, there are apps out there that can help you kind of be more self-aware of the grams of carbohydrates that you're consuming. If you have diabetes or you're trying to limit your diet, your carbohydrates in your diet, or you want to follow the MyPlate method, which is recommended for even people without diabetes, you can download an app. For example, the one that I commonly recommend my patients with diabetes and without diabetes is MyFitnessPal. So MyFitnessPal, you can plug in like what are you gonna have. They often have the grams of carbohydrates for food out there, like from Panera or Chick-fil-A, McDonald's, etc. But they also can have like just general portions and information on the grams of carbohydrate that are not coming from a sandwich that you eat in a chain restaurant. But you plug in basically like Panera sandwich, the name of the sandwich, and then it tells you the amount of grams of carbohydrate in it. But you can also put like one slice of this type of sourdough bread or whole wheat bread. Sometimes you can even put, depending on the app, you can put the brand and it tells you exactly which one. It has a rich database on it. And so with that, you can actually even pick it out and start tracking the amount of grams of carbohydrates that you had in a day. Because I don't know if it happens to you, but to me, I sometimes don't remember, like if I'm gonna have lunch, I don't remember how many grams of carbohydrates I just had in breakfast. I can't track how many grams of carbohydrate I've had in a day. So plugging them into the app, every single meal that you have can help you track those calories, those macros, and the progress. Another really good thing about these apps is that if you are meeting with a nutritionist specialist or your provider and they're asking you about what your diet looks like and you don't remember what you ate past more than 2 or 3 days, you can go back to the app. You can actually download these reports and provide it to your doctor or to your nutritionist. And you can have a more comprehensive visit with your doctors that are tailored towards your daily routine, your daily diet, your daily lifestyle. And then help you make healthier choices. If you picked a pasta that was this brand with this many grams of carbohydrates, the nutritionist can recommend you to use instead this brand, etc., so that you can continue to have a healthy diet, but that lowers that glycemic index. Glycemic index basically means how much does your sugar go up with every meal. So that can be a little bit overwhelming for your pancreas if you have a high glycemic index versus if you have a lower glycemic index. It means that your pancreas is not working too much all of a sudden, which can eventually leave the pancreas burnt out. So picking foods that have lower glycemic index, etc., when you keep a diary of those meals can definitely make that experience with your nutritionist even better. And you're able to accomplish more per encounter. And then I don't know if you've heard this before from my previous webinars, but one of the best tricks that you can do when you're eating is always eating your salads first. That's the best trick that you can have under your sleeve that doesn't take much to do. When you eat your salad first, it lowers your glycemic index, and it also kind of tricks your brain into thinking, okay, I'm already eating. So your brain is already starting to release that hormone that makes you feel fuller quicker. And by the time you reach your carbohydrates in your plate that you're gonna consume, it can even make you consume less carbohydrates that you would have if you would have started eating your carbohydrates first, your sugars first. So that is a very cool trick that I always recommend to every patient that I have. And I try to live by it every day, even though sometimes you're craving that carbohydrate, you want to have it first. It's definitely a daily struggle for me, but it is a really good trick. And you can definitely see the difference. And then the MyPlate method has an app there too. So this last slide, if you want to take a picture of it, I think this is something that I actually have as a picture in my favorites in my phone when I'm trying to pick healthy foods and avoid unhealthy foods. This is something that is crucial for me. So avoiding saturated fats, avoiding adding sugar to your coffee, to your oatmeal. Those are things that will significantly help you live a healthier lifestyle. And then limiting that sodium intake. So if you don't have any conditions, chronic conditions, and you're just generally healthy, it's recommended that you limit your sodium to less than 2,000 grams in a day. However, if you have high blood pressure, you're at increased risk of having a heart attack or a stroke, you have diabetes, etc., the sodium restriction is even more. It goes down to like 1,500, 1,200. So it's recommended that you consume even less sodium than a general population if you're at an increased risk of having those heart attack or strokes. And then in general for women, it's recommended that you have 25 grams of fiber in a day versus men, it's a little bit more, 38 grams. And then your food, right, should be very heavily on vegetables, legumes, and fruits, as you've always heard on your health class. And then trying as much as possible to have 2 or more servings of oily fish per week. So that's your salmon, your trout, your herring, or your mackerel. So I'll make this really quick. But if you go online and just put American Diabetes Association recipes, they have diabetes-friendly recipes here. This is what it looks like. If you have time to cook, which is usually for me the weekends. The weekends I try to visit this website at least once and cook a dinner and have some extra for like a next subsequent meal from these recipes. That I made it a personal goal to do this. Which is for me achievable, but whatever is achievable for you. Let me share my screen, sorry. So this is the website and it goes over diabetes friendly recipes for breakfast. They kind of feature specific recipes here. And then it kind of makes you choose from a wide variety of recipes that they follow. You can view all recipes here. And then it just kind of classifies it to which type of meals you want to explore. Can everyone see my screen? Yes, okay, thumbs up, perfect. So
it may not be in presentation mode right now.
Oh, it's in presentation mode?
It doesn't look like it is.
Oh, okay, wait. I'm in a website. Let me see, share. Okay, share screen 1. Okay, perfect. This is what, so you guys can see that it says here diabetesfoodhub.org recipes, and you can see breakfast and brunch, lunch, dinner, snacks, desserts. This kind of gives you a general idea of what a diabetes friendly recipe is. All right, and then the other website that I wanted to go over that incorporates culturally diverse recipes, it's there's two. There's the myplate.gov. And then you can explore here the different, so this tells you what are the different recommendations for fruit portions, vegetable portions, following that MyPlate method. And then they have these resources also in Spanish. And then you can find the recipes here in MyPlate Kitchen. You can pick them depending on the type of cuisine that you want to have. Is it Asian, Caribbean, Latin, Mediterranean, vegetarian, etc. Alrighty.
One quick question, Dr. Cadilla, and I hope that this is not a bad question. And I'm not asking for myself, I'm asking for a very close friend of mine, Mrs. Sanja Philpart.
Yeah.
When you start talking about carbs and sugar, is there such thing as a healthy alcohol or a healthy portion? You know, some people say drink wine. I don't laugh. This is, my wife really wants to know the answer to this question. Not
No,
me, I promise.
absolutely. That's a very good question. So, of course, if you have diabetes, especially diabetes type 1, which means that you do not your pancreas does not work at all, right? If you have type 1 diabetes and you want to consume alcohol, it definitely can be a little bit challenging because your pancreas is not working. It's not producing any insulin, so it's not doing it's not giving you any help to help regulate the blood sugars. So if you have type 1 diabetes, you're going to be very sensitive to any kind of alcohol. And the thing with alcohol, it's a double-sided edged sword. Too much can definitely either have you have high blood sugars, or it can also cause you to have low blood sugars. So if you consume a alcohol that does not have carbohydrates, like a vodka or a rum that is not made out of cane of sugar, that is not going to increase your sugars, then basically it can overwhelm an essential organ that's in charge of processing the alcohol and detoxifying your body from the alcohol that you're consuming and eliminating, called the liver. So it can overwhelm the liver, and then it can cause you to have a low blood sugar. And then if you have beer that is really high in grams of carbohydrates, although there are beers out there that do not have grams of carbohydrates or sugars, then your blood sugars can go skyrocket pretty high, and then also cause you to have a dangerously high blood sugar that can send you to the ED. So with this, it is very important for you to control the portions. What are the recommended alcohol limits for men and women daily? Women are supposed to not have more than 1 to 2 drinks, and then men, it's a little bit more flexible. Correct me if I'm wrong, but I believe that men can have, I think, 2 to 4. Let me just double check that. But that's the daily maximum recommended for people to consume. And then if you have diabetes and you're insulin dependent, etc., choosing that alcohol can definitely be challenging, but preferably an alcohol that does not contain a lot of carbs. There's beers out there that don't have a lot of grams of carbs. There's now like these new vodka seltzers that are very low in carbs. So definitely those are the ones that I would target if I am going to consume some alcohol, and then keeping in mind the portions, the maximum daily recommended needs of alcohol based on gender. Dr. Gavin, if you wanted to add something. thought I had you. There you
Yeah,
go.
I would simply say the thing to be most mindful of is the fact that alcohol is not free. Calories in alcohol count. Alcohol itself counts and is handled by the body like a fat calorie. So you have to really calculate how many calories are you taking in. So that means portion size becomes really important. Secondly, alcohol itself is going to be processed by the liver, as Dr. Khadija says, and that means that you're going to be taxing the liver's ability to do other things if you stress it with alcohol. So the key thing is portion control. That's why we talk about, limiting the sizes to 3 or 4 ounces of wine or X number of ounces of beer. But the other thing to remember, in addition to portion size and the fact that you have to factor the calories into your diet, your overall diet and nutrition calculations. The other thing, remember, alcohol can interfere with your medications. And that's the other thing you don't want to forget, that you're introducing a competitor to the way your medications can work if you exceed a certain portion of alcohol consumption.
Thanks
Absolutely.
to both of you.
Yep.
I'm sorry, Dr. Cadilla. Yes, ma'am.
I just wanted to add really quick. Yes, in pharmacy school, one of the main things that you learn about is how smoking tobacco can interact with your medications, and then alcohol, and then grapefruit juice. Those are the 3 main that always are like very red flags for me. But go ahead, Toby, and then I think Christine Thompson has a question.
Yes, so Sister Thompson is going to ask a question, then I'm going to introduce our next speaker. Thanks to each of you all for joining us. Sister Thompson. You're on mute, Sister Christine. Sister Christine. There you go. I saw you unmuted. Am I the only one that cannot hear her?
Pastor Philpott. Can everybody hear me?
Hear you loud and clear, Doc.
Okay.
Put your question in the chat, Sister Thompson.
Something really quick, guys. So I just called out, we're doing a health fair here at the church here that's in Lauder Hill. And I just met with the Pastor Tillman, who is a pastor at Piney Road. I get called out to see a person had an issue. This patient, she's on medication, metoprolol, Dr. Gavin. Her blood pressure, and I checked it twice. Sitting down, standing up, 191 over 123. Okay, she's only on 1 medication, and that is metoprolol. That's it. Okay. Then I got called to another person. This just happened just now. I don't know if you guys can see this or not, but I took a picture of her along with it. She said, "It's fine, I can show you this with her blood pressure itself, right?" I'm telling you guys why this is so important to get this diet thing right and to get this exercise things right. Because here's another person, not the same person. Her blood pressure, she's a VA veteran, so she's a vet pastor, Philpott. Her blood pressure today is 155 or 122. We got a real problem here, guys. So continue on, and I'm glad to see them hit those numbers. Pastor Philpott, we're well up over 50 something, which is great. And a lot of love to everybody, but I just want to let you guys know what I'm out there doing. We got to continue on the good work. So thank you, guys.
Thank you, Dr. Reynolds. Our next speaker is a physical wellness presenter, and I have come to know and love him. Dr. Gavin, I'm going to ask you to tag team and introducing Justin from this perspective. There's something you always say, do a little bit more. If Dr. Gavin can kind of bridge Justin in as to the importance of physical activities, and then we'll hear from Justin.
Yeah, the only thing I would say is, before Justin begins, is that whenever we start talking about diabetes, especially type 2 diabetes. Remember, that's 90 to 95% of the diabetes that we talk about. And diabetes travels with all the other chronic diseases, hypertension, obesity, high fat, cholesterol, and so forth that we're worried about. Remember, the two recommendations that you build everything on are: one, less than you're doing now. That's usually talking about the calories, the portion sizes. And the other one that Justin focuses on is more than you're doing now. And that is more physical activity. You don't even think about physical exercise. You think about physical activity, moving and making sure that your body is active. And the final thing that I would say before Justin starts is, remember this: virtually every medicine that is prescribed for you for chronic metabolic diseases like diabetes is based on using it as an adjunct or in addition to what? Diet and exercise. Those two things basically open the door for whether these medications are going to be effective for things like lowering your blood pressure, lowering your weight, or lowering your blood sugars, or lowering your fats. Justin, it's all yours. Talk to about how we need to keep moving and moving healthily.
Well, thank you, Dr. Gavin. I don't think I met you before, but that was a really good introduction. If we can put up those slides, that'd be awesome. And then we can go ahead and go from there. All righty. So we're going to go ahead and talk about battling hypertension. Well, welcome to our health and wellness session. I'm Justin Reynolds, as Dr. Gavin just politely put it, and I am your CHP coach for today. You know, we're going to talk about it head on. I'm going to get ready for some eye-opening, facts and life-changing advice. But our focus mainly today is going to be on physical activity and ways to basically manage your own health. Let's go to the next slide. So these are actually three big things I want to talk about today. So we're going to talk about just the power of strength training. Muscle mass, it matters. Bone strength, it matters. And the dual benefits is what we're going to talk about a little bit later on too. So let's talk about muscle mass. Building muscle improves blood vessels functions. It's not just about looking good, it's also about feeling good as well. Now, if you look to the left on the two ladies that are working out with band work, that's where I'm about to go to next, is about bone strength. So basically, stronger bones contribute to overall cardiovascular health. And, basically don't underestimate the power of resistance training. What they're doing are basic workouts with resistance bands. Now, resistance bands can be anywhere between 10 or 5 pounds to all to even 100 pounds. Yes, resistance can be up to 100 pounds. The cool thing about resistance training is that you don't need a gym. You don't need a membership to a gym. You can bring these things wherever you are. If you're at the office, if you're going out of town or whatever it is, you can bring them with you. They bend really, really nicely. Put them in your put them in a bag and go on over. When you do those things, you have no excuse. And that is kind of the thing for me, is knowing that we are creating more and more things that we can use to allow people to not have excuses to not work out and be active. Which is probably the most important part about this whole entire thing, is about being active. Now let's go to the next slide real quick. All right, so these are some aerobic exercises that I would love to talk about. We have walking, we have jogging, we have cycling, we have swimming. Now these are just a few, right? There's a lot more than that. We could talk about walking first. I know my dad does not like jogging. He does not like it to hear the word jogging, because I understand what he's talking about, because he is right, especially people with joints and joint issues, so on and so forth. It can be really, really bad on people's knees, on their feet, on their shins, whatever it is, and whatever have you. But let's talk about walking. I have a few clients that I see on a day in, day out basis, and I will say that they do more walking than they do jogging. Right now, I tell them there's nothing wrong with walking. They have these Apple Watches, and it tells them they did 10,000 steps. Now, I think they're lying to me, because they just stay at home, and I don't know how they can do 10,000 steps at home. They can clean, but that's a lot of cleaning. But again, the thing about the whole entire 10,000 steps though is that at least it's giving them a goal of something. Now, whether if that is walking, whether it's jogging, the whole mindset is the goal mindset. And that's really what I wanted to focus on the most with them, is to be goal oriented, because it keeps them wanting to do something and keep on going, keep on going. Hey, this time I did 10,000 steps. Tomorrow I want to do 10,500 steps, right? The more we do goal-oriented things, the better it is. So anyways, walking is great. You can walk to the beach. You can walk and shop, right? Like a lot of people like to go shopping, especially the holidays is coming up. So why not go to the mall, walk around a few times, so on and so forth, and that. Now, jogging. For the people that don't have issues and ailments like that, especially joint issues, so on and so forth, jogging is probably one of the nicest things that I can think of for me personally, for people that I also do train as well that love to run, some that do marathons. I don't know how you do it, but you can. There's this thing called runners, I don't know, it's like a runner's like focus mode, like a runner thing, tunnel vision based for runners. And it's great for their mental health, which is a huge thing, right? Mental health is a huge thing. And same thing with cycling. Cycling is great because you can be inside, you can be outside. If you have a Peloton, if you do have one, that's awesome. If you don't, if you have a regular bike, go outside and cycle on through. The cool thing about cycling and the cool thing about walking and jogging is that if you don't have a machine and you can go outside, the thing is once you go a mile away, well, you got to come a mile back, right? Like there is no stopping. You can't just stop and that's it. Swimming. Well, swimming is great because it's an overall body fitness, right? Which is kind of like playing basketball. Your whole entire body is active, which is a great thing, especially if you're trying to go on hypertension. Next slide, please. Okay, so the AHA recommendations. Oh, well, so the moderate intensity aerobics and vigorous aerobics. What do those two things mean? Well, it's exactly what it sounds like, right? One is moderate and one's gonna be a lot. Now, the moderate version of what people want to do is kind of like when you go to the gym, and let's say you go to the gym 2 or 3 times out of the week, and you go there and you have your set thing, which is if you're with a trainer or if you're by yourself and you're looking at some videos, which I hope you don't do that. I hope you just go to a trainer, right? A lot of people like to do that, by the way, like to go on YouTube or whatever. And I try to tell people to kind of stay away from that because the problem is that they're not going to focus on critiquing your technique, especially if that person can't see you, right? And you're just focusing on what you're looking at or whatever. We call them gym vultures. When we're at the gym, I might see somebody literally like watching or staring at others like work out and like, oh, I'm gonna do that next time, or I'm gonna do that, whatever, and get some ideas. Here's the problem with that. You know how people like to talk about people dying from secondhand smoke? Well, I call this like having really bad secondhand bad habits. And that is something that I don't want people picking up on, right? Are bad habits. But going back to the moderate intensity, I think that's more of a, we're going to work out maybe for like a 45 minutes to almost an hour and then go from there. Vigorous aerobics, that's like HIIT training. You're going at it. You're going at it as hard as you can. Next slide. And that's what I was just talking about. So high intensity interval training, which is AKA HIIT. If you're new to the exercise area, just know that HIIT is a big thing that's out there right now. It's been a thing that's been out there for quite some time. It's just no one really called it HIIT. They just said it was just working out hard. Intense bursts. It's basically just pushing yourself to the maximum that you can for a short period of time. But when you stop and you want to calm down, you're not going to stop completely. You're going to slow it down where you're going to continue to move, which is the active recovery. And that's kind of really crucial to building your endurance. And that's actually what a lot of people like athletes, so on and so forth, and even regular people need to start doing so that they can build their stamina and obviously cardiovascular. And you repeat that process. Basically, if you want to do 3 more times, 4 more times, whatever it is, and you go from there. Next slide. Now, these are 3 crucial things that I wish I would have did way back before I started lifting extremely heavy and I destroyed my back. And what I mean by that is these are really good isometric exercises for your core strength. And so you're looking at bridges, planks, and wall sits. Now, the top left, you see these people laying down, butt up, and basically holding a bridge, right? Where you can kind of like go underneath them. That's a full bridge. Well, we kind of do the exercise to go up and down, right? Like a thrust. But when you come down, you don't want your butt to touch the ground. You want to hover and come right back up. That's just building more of the glute and core strength. Same thing with the planks that you see the young lady doing right there. She's on both elbows, legs straight out, nice and flat, looking straight up, not looking down, but looking straight up. all that is basically perfect. Now, again, the reason why these things are important is because it's building on your core, right? And the core is probably one of the biggest things for your body, especially for me. I wish that I did majority of these workouts, like I said back then, or else I wouldn't have my L4, L5 herniated disc. But hey, it is what it is. You live and you learn. Wall sits, as you see the gentleman on the bottom, he's literally on a wall sitting down and holding as much as he can and not trying to stand up. For beginners, we normally tell beginners, like in planks or especially wall sits, you want to hold it for at least 20 seconds. It's a 20-second hold. If you do more than that, then you're basically intermediate. If you want to go really advanced, I think the world record is like almost a day. Yeah, no one's doing that. That's a lot. It's a lot. Next slide. Right. So this is probably one of the most biggest parts. Accessing your fitness, set realistic goals, and mixing it up. I think the most important part about all those things is a realistic goal, to be honest with you. I know that assessing your fitness should be the first thing, but I think setting that realistic goal is the most important thing. I've had numerous clients that I will not name, but I will say that I had an 80-year-old female that says she wanted to look just like J-Lo. It's not possible. It's not possible. I had a gentleman that was 300 pounds that wanted, to look like Muhammad Ali back in his day, whatever, right? And that actually could be possible, right? Because he is relatively young, but we're not going to make sure we make him look like Muhammad Ali. We're going to make sure we make him look like the best version of himself. And I think when you can kind of push down on the like excitement level and just understand that we're actually trying to build you to be a better you and not to be this person or whatever, that kind of puts things in more perspective. I think realistic goals are the best way, for anybody. Now, assessing your fitness, you have to be honest with yourself in your current fitness level. If you're not advanced, right, I'm not going to tell you to just stand up and go do 10 burpees and then sit back down, right? Like, no, like that's not how we do it. We got to start somewhere and then build our way up. So being a beginner is fine, right? Like, it's not like you're going to go from white belt straight to black belt in one day. That's just not how that works, right? There's plans, there's things you got to do. So you got to start from somewhere. And yes, variety is key. I think the variety of things, when you're going up and down, up and down, up and down, you want to switch it up. Because if you kind of stay in one particular area, your body is going to recognize it. And it's kind of going to just be like, okay, I'm a plateau right here then, and that's it. So you want to definitely mix it up and down. Next slide. And yes, these are probably the biggest ones. Consistency is key. Listening to your body, celebrate your progress, and seek support. I'll say this, as someone who has come from what I've done, the amount of times that I've done it, and how many times I go to the gym or whatever, I think listening to your body is big. Because if you feel like you're hurt, if you feel like you don't feel the best that day, a lot of times people be like, oh, well, just go to the gym still. You got to go to the gym. You got to still push through it. I'm that person. I'm literally the person that's still... Everything I'm saying right now, I do not follow. I promise you right now, this very moment, I'm saying if I don't feel good, I'm still going to the gym. But I'm telling you, as someone that tells it to people, if you don't feel well, don't go. And there's a reason why, because it's one thing to say, well, I'm here, just at least I showed up. But the problem is that if you still show up, you might not be able to put in that amount of effort that you need to put in, and that can get you hurt. And that's exactly what happened to me, even though I don't listen to my own advice. I wish I should. Now, consistency is key. If we're just going to the gym once a week, what are we doing? If we're just staying active once a week, what are we doing? It's not going to be beneficial to you at all. If you make yourself a nice plan, or if you visit someone like me or another personal trainer or a coach that will build you on consistency, then you'll be good and you'll be going into the right path. Other than that, seeking support, yes, and celebrating your progress. Celebrating your progress is probably one of the biggest things too. If you did a milestone, if you couldn't do 10 push-ups, now you're doing 20, celebrate that. Feel good about it. There's nothing wrong with feeling good and showing off you could do. If you could do 20 push-ups and like you go to somebody and like, man, I can do 25 now, whatever it is, those things are great because it's pushing one another. And that's really about it. Next slide. Yes, my before and afters. Look, I'm only showing this just because of the simple fact that the guy on the right-hand side is a good friend of mine, good friend of my dad. and that is Dr. Rudy Moise. I'm not sure if he's watching it now, but I'm sure he would love for me to be watching this. I'll say this. When he was 69 years old, he was on the left-hand side in that Calvin Klein short. And when he turned 70 years old, which is just a year, but at that time it was like 6 months, he went to that on the right-hand side. That is what I mean by it doesn't matter how old you are. It don't matter, people like Dr. Moise, I know. It don't matter how old you are. It doesn't matter, you know, how busy you are. Because if you know Dr. Moise, you know how busy that man is as well. He does everything, right? So the simple fact that he doesn't have an excuse shows you like that too. My guy on the left-hand side is a client of mine. And, you know, he's from Boston, which we do, you know, we can't judge, you know, Boston youth. But still, at the end of the day, he was 320 pounds when I first met him. He's 6'7", big guy. And then about 7 months later, we dropped him down to that. And, you know, I think part of the issue with him is that he was showing signs of, you know, being diabetic. He was showing signs of really bad heart problems. Confidence was at an all-time low. And, you know, he said, Justin, I really want to switch up my life around, right? I want to be around for my kids. And that was it. And then we went from there and boom, and it exploded. But my point to all this is that staying active is very important. If you find yourself around a gym or around a personal trainer or whatever, and if you think you need one, please go get help. If you think you need someone like myself, come to me. I can guide you the right direction or whatever, maybe work with me, whatever it is. But I do think that at the end of the day, what this world needs more of, because right now I believe we're headed to like 85% of obesity in the United States, which is crazy. Like it's very crazy. I'm speechless at that. And at some point in time, we got to get our things together, and hopefully it starts now. And that'll be it. Hopefully, if you guys have any questions, post them up in the chat. I'll be happy to go ahead and answer as many as I can, if there is any.
Awesome, Justin. Yes, Dr. Reynolds, I think he's coming in.
Yeah, I want to say it's very good. That's my son. I noticed that I feel the same way as Pat Scope out there. He posted something that we were talking. We want the Rudy Moise plan. I want the Rudy plan. I'm 73 years old, Rudy's 70. And I don't think I look quite like him. I'm trying hard to go by. But I need that Rudy Moise plan. That's amazing. My son's right there within our office compliance. It's called the Pit Factor. The gym's out there. And I don't recall him ever pushing his dad, me, to come join him and getting more fit. Okay? So the bottom line of it is that I want to use this opportunity.
Wow.
Hey, man, I have everybody on here.
Wow.
I have 45 people. We have about 58, it looks like, which is great. But I want to take the opportunity when everybody's here to say this to Justin. This is just a challenge for me for the new year. Get me to like Rudy. Okay? It ain't that bad. I'm okay. I'm not that bad. I'm really not.
That's like the 81-year-old that told me she wanted to get just like J-Lo. But all right,
I'm so like
got it.
Anyway, that guy.
May I introduce just a little bit of reality check into this?
Hey, Dr. Gavin, before you do that, Justin, you have a young lady who's asking how does she sign up for personal training?
Oh, that's very simple. If you want, go ahead. I'll put it in the chat. I'll put my information in there, and then she can go ahead and either email me or text me.
Sorry about that, Dr. Gavin. Sorry about that.
No, I just wanted first and foremost to thank Justin for really putting this into excellent perspective and to highlight a couple of points that he made really very nicely. You know, it's start low, go slow. You know, it doesn't matter that you can only do 3 blocks now, but consistency, regularity, keep at it, because you know what? Soon you'll be able to do 10. And that's the key. That's how you get to be a Rudy. Okay? It's the consistency. He didn't do that by coming in this week and then a week later look like that. You know, that was months and months of consistency. So, point number 1, start low, go slow. I had a patient, a group of patients. I used to lead in an exercise or physical fitness routine. I used to actually lead it back in the day. And some would say to me that, Doc, I think I understand what you mean by all of this, because I used to feel bad when I used to try to do all of this exercise. And now the only time I feel good is when I exercise, because that's what a difference it makes. Healthy muscle is why you have rehab. Healthy muscle burns more fat. Healthy muscle burns more of those carbs that you don't want circulating around in your body as glucose that's excess in diabetes. Healthy muscle actually builds blood vessels that have lower blood pressure. And that can actually give you better delivery of things to your brain and your other vital organs. So all of this is really key to have this combination of regular physical activity on a consistent basis. And then the final other thing that I'm going to say, Pastor Philpott, is this. I used to give patients the advice that, you know what, it's the holidays. You know what, I want you to celebrate the holidays. I want you to have that meal with your family. I want you to take that extra half an ounce of holiday cheer. But remember, the holidays only last a few days. Once they're over, get back to the consistency that Justin just highlighted. That's what we're really trying to do. That's what we call changing lifestyle, and that's what's really important.
Thank you, sir. Dr. Gavin, Dr. Reynolds, from a medical doctor perspective, Justin hit it. You don't okay to take a break. That was interesting. As I shared in a webinar before, I've been walking, had a cold coming into my body the last week, and I did what Justin just recommended. I was feeling guilty, but when I was able to start back walking, I was happy that I took his advice. From a medical perspective, you guys add to that.
I think that almost is one of those things that speaks for itself. Listen to your body. Your body will generally give you pretty good directions. And when you don't feel up to it, just as Justin says, that's a time to take a break from it, but don't stay away from it. When you get back to some kind of a baseline, get back into it, because that's the path. Beatrice, Dr. Cadillo said earlier, this is a journey. It means that you stay on the path. It's not about a destination. This is about what you are doing. It's the constancy of the journey. And that's what you're going to be hearing from us over and over again. What it means to be on this journey, what it takes to stay on this journey, and to make sure that it's the best possible trip that you can have. And that's what happens. You need to take a break. Don't push through when your body is telling you that, you know what, not today, Toby. I need a day off. Take it off, and then get back to it when it's time.
Dr. Reynolds, I give it back to you, sir.
Let's have a question, Dr. Chaplain Ray. Reverend.
Yes, sir. Thank you for taking my question. I'm sure I know much of the answer to this, but I want to hear it from you all. Back in October, I had an awful fall in the airport. I literally fell on my head. My left side of my neck has been hurting ever since. My right knee has been hurting, and my hand has been hurting. And unfortunately for me, in January of this year, I was in an automobile accident, and I've been going to the doctor for therapy so much. And I have just not wanted to go through therapy again for this fall. I'm being really stubborn, but I'm hearing you say, listen to your body.
100%.
Listen to your body. So my neck is still hurting. So doctors, just go ahead, reprimand me, please. Tell me what I have to do.
Well, yeah, being an ER doc and involved with some other parts of medicine and surgery. One, the question is, have you had your neck thoroughly evaluated? In other words, imaging tests, not just an X-ray, but typically an MRI scan to see what's going on with your neck. If you had a car accident, I'm not sure if you got hit from behind or whatever it is, you may have had they call it like a whiplash. which is a forward movement and a snap backwards. That will cause some issues to the muscles, right? But you can also cause some issues with your nerves in your neck from having a pinched nerve from perhaps a protruded disc or herniated disc, right? So you want to make sure that the doctor, whoever you're treating with, they should have done an evaluation of your neck. I'm not gonna ask how old you are, but let's assume that you're over 55 years old or so. Then I have all of the kind of things that come into a differential diagnosis. So the first thing,
74.
okay, well, to the club, I'm 73. The thing is that we tend to forget sometimes that our bones are a little brittle. Our muscles are not as relaxed as they used to be. In fact, they become a little contracted. So it's easier for us to have a little minor fall, so to speak, have some significant problems. Hitting your head, first thing I think about a DR doc is asking if you're any blood thinners, those kind of things, right? Because I'm concerned about there being a bleed. Older we get, the smaller our brain gets, but the skull stays a nice size. It means that, you know, the brain has a tendency to scramble around in your skull. Inside your skull has these little sharp spines, little spikes, which can cause little lacerations, little cut, contusions, and that kind of thing. So I would suggest, basically getting back to it, that you should have had a thorough workup, that you should now, especially if you're still having issues, because your body is telling you that you need to be evaluated more thoroughly with imaging.
Yes, sir. Thank you so much. Thank
Sure.
you. I'll do that.
Yep.
Thank you.
And if you need me, you know, call me as a second opinion doc, didn't cost you a thing. I'm happy to take the call.
Thank you, sir. Thank you
You're
so
welcome.
much. Bless you.
Sure. Okay, I guess is there any more questions? If not, we can move to dismiss with a prayer, but are there any more questions from anyone?
Dr. Reynolds, will you share how a person can reach you at Center for Health Promotions for follow-up questions?
Sure, you can reach me you can dial either my phone number, which I'm good with that. Patients don't tend to abuse that unless having issues. 954-218-6904. Maybe someone will put that up in the, you know, I guess in the chat. And you can also use the office number too. But at the end of the day, people tend to call me and I'm okay with that. And I'm your second opinion doc. I'm your other doc. And my job is to make sure we can be healthy. And we're going to do that.
Sir, please repeat that number. Oh, I see someone has put it up. Never mind. Thank you.
All right, sure. You guys have really been awesome. I mean, we went more than our numbers, which I always feel good about that part of it. Because we're getting ready to apply for appropriations, which with the state of Florida. We want to begin to be more inclusive to all of our citizens of Florida that are in disparate areas, that are in underserved areas. And that covers pretty much the vast people of faith, right? Faith-based community that includes of course, my Baptist people. I'm a Baptist, but it includes the Pentecostal, the evangelical, that includes everybody really, the AMEs, you name Catholic, you name it. Because we have to get about the business of our Father and that to take care of all of us. As Dr. Gavin will tell us, and Dr. Beatrice will also, when we took the Hippocratic Oath, it was not to take care of just one set of people. We were taking care of everybody, right? But this grant that we have now specifically focuses on people of color, especially African Americans. The appropriation that we're going to be asking for, which is millions of dollars, by the way, is to cover people that are not of color, but have the same circumstance. Sometimes even worse, believe it or not. So we want to get into those rural communities, take care of those patients too, want to be able to take care to them, right? So we want to expand upon what we're doing now. It is only through you guys that makes it possible by going on to webinars, attending some of our events. And I have a webinar coming up, guys, by the way, and I hope mine is as well attended as Dr. Gavin's and Dr. Della, my son Justin. Okay, I'll be able on December 28th. That'll be going out to everyone as well. And this is more about things I would see in the emergency department with strokes and heart attacks, so on and so forth. I'm gonna mix up a little bit, but just give you guys a taste of what it's like to be an ER doc, basically, come in with patients who have symptoms and so on and so forth. That's gonna be December 28th. It's gets to be from 11 o'clock until roughly 12:30 or so. And the other thing that we do is we're out here now doing over at Pine Grove here in Loud Hill, back to church, we're doing a health fair. It's going on very well out there, and I'm loving it. What I don't like to see are people that have doctors that are still in bad control in terms of hypertension. That's inexcusable to me. They take the medication, and I believe that. But when you hear the medications that they're taking, Dr. Gavin and Dr. Della, these are medications that we used to use. We found that they're not very effective for Black folks using them, and therefore they're getting into issues. So when I see someone who's on a beta blocker, for instance, have the pulse rate guys are 99, take the medication. They showed me they took the medication this morning, pulse rate is 99, and the blood pressure is 210 or 120. That gets me very scared, very nervous, right? So the bottom line is, guys, that we're here to make sure that we bring the services, healthcare services that you need, but not only healthcare, but also healthcare. It's mental health also, right? It's just that this grant does not cover those things, but we're going to still mix it up. We're going to put in some prostate cancer, some breast cancer, some colon cancer. These things are all very prevalent in our community. We have to catch it last. In other words, we are late finders of disease. When we do find it, good luck in us trying to find someone to help take care of us.